and Reykjavik University that, as Paolo said, hosted me for almost a year, and in which I developed an in silico methodology to evaluate how bone remodels in patients that underwent an operation of total arthroplasty 6 years before the study. So just to briefly introduce the context, bone remodeling after total arthroplasty is an important factor to understand bone quality right after the insertion of the prosthesis, and also to assess how this process can change in the long run. Existing studies uses DEXA scan to assess bone mineral density in 2 dimensions, which it gives a quantitative assessment of bone mineral density, but it can lose some pivotal features since bone remodeling, it is a 3D mechanism. So the aim of my work was to develop a methodology to assess in a quantitative way how bone remodels in a 3D way, by localizing the evolution in the 7 standard growing zone. We're going to see later what does it mean. And in the long term, so 1 year and 6 years after the operation. To reach this goal, CT scans from a longitudinal study were used to assess the bone mineral density evolution throughout the years. So the first step was the data collection. So the CT scans from the same patient acquired 24 hours, 1 year and 6 years post-operation were collected from the Icelandic database. The first 2 were performed with a Philips Brilliant machine, the latter with a Toshiba one, so all the information are reported here in the table of these 2 machines. And a CT calibration was performed on the 2 machines, so to convert the Ansfield unit to values of bone mineral density. So the CT scans were then opened through Mimics to perform a scatter reduction to reduce the metal artifacts. And then the femur were realigned through the longitudinal axis up to 2 centimeters to the distal tip. After, we performed a segmentation to isolate our region of interest, the femur, and to obtain the 3D masks. So the bone mineral density was then assessed, the bone mineral density evolution was then assessed over the time, and also to better localize, to better locate where these changes occurs, we developed an automatic algorithm to split the femur in these 7 zones defined by the Gruen standard protocol. And so we can see here from the 7 zones how they are calculated. The method that was developed was then tested on 12 patients, 5 with a cemented implant and 7 with an uncemented one, to have some preliminary results. And then a comparison was done to see any difference between the cemented and the uncemented cohort. And also we reported some example of Gruen zone assessment. So results of the bone mineral density. Here we see the average and the standard deviation of the bone mineral density evolution for the cemented and the uncemented cohort. So the blue, red, and yellow line stands for post 24 hours, post 1 year and 6 year post-operation respectively. On the x-axis we have the bone mineral density, and on the y-axis we have the frequency, the percentage of voxel at that specific density. With this line, we split what we consider trabecular bone from the cortical one. So we have to highlight 2 results. First of all, we see that the cemented group has a lower percentage in trabecular bone rather than uncemented one. And this is caused by how the surgeons perform the surgery, because basically they have to remove more bone stock to place the cement in case of a cemented fixation rather than the uncemented one. But also we have really values of high standard deviation are really high, up to 40%. This is caused by the high interpatient variability that we had throughout our cohort. For example, they differed a lot in age. The youngest patient was 39 years old when the operation was performed. The eldest was quite 80, was 80 years old. And also for the gender, they differ for the physical activity. But this is kind of good because with a proper validation, this method might be really sensitive in assessing any difference throughout the patients. So about the Gruen zone assessment, here we see an example of a female, 63 years old when the THA operation was performed, with an uncemented prosthesis. Here we have the BMD evolution of two Gruen zones, one that is the Gruen zone 7, so one of the most proximal one, and one a distal area. So here we see the evolution, blue, red, and yellow line, of the trabecular and the cortical bone. The area under the curve for both the trabecular and cortical bone was then calculated, and data were normalized by the post 24 hours data to assess if there was an overall increase or decrease in bone mineral density throughout the years. And the results show that after 1 year there is no significant changes. But after 6 years, we can see that there is a significant loss, reaching almost minus 50%. In cortical bone, in the more proximal area, with a slightly increase of trabecular bone, while in the more distal area, we observed a completely opposite behavior. So just to conclude, the in silico methodology that we've been developed, it can be easily employed to quantitatively assess how bone remodels in a 3D way, localizing these changes in the Gruen zones and in the long term. We tested the method and it gave good results in terms of reproducibility. And throughout a proper validation of the results that we obtained, this method can be used as a tool that we can give to the clinicians for the follow-up of patient when a failure of the implant is to be expected, and also as a tool for optimal strategy for revision and also for rehabilitation purposes. Thank you for your attention, and I'm open up to any questions.